Routinely, how many hours you study in a day? 5, 6, 7 hours. Impressive. What about a day before the exam? How many hours you study a day before exam? 12, 14, 16, maybe 18 hours. So why? Why this change? Why you study more before exam, more hours before exam? So the answer is adaptation. Human body is able to do adaptation in response to stress. So your body, here the stress is the exam. Your body is doing adaptations in response to stress by giving more time to the studies. So this is the example, macroscopic level. This is an example of adaptation. At cellular level, at microscopic level, all cells of human body have capability to do adaptations in response to stress. So, in this session, I am going to teach you cell adaptations. Okay. So, we know that human body is made up of cell. From head to toe, the human body is made up of cell. Cells are the structural and functional unit of life. Normally, all cells are in homeostasis. What do you mean by homeostasis? Each cell is assigned a particular function and a particular structure. So, all the cells in human body are performing their own job. For example, the cells of the salivary gland, they are doing the function of secretion, secreting the saliva. The cells of the intestine and stomach, they are doing the function of absorption. So likewise, different cells in human body are doing different functions which is particularly assigned to that particular cell, and they are having a particular structure. This is known as homeostasis. So in this diagram, you can see a cell. It is a normal structural cell and it is in homeostasis, right? So normally all cells are in homeostasis. But whenever any stress acts on the cell, now the stress can be physiological, can be pathological. You can understand the difference between the physiological and pathological, the two types of the stress. Physiological stress is the stress which is not a disease. For example, pregnancy, it is not a disease, but it is also not a normal state. For example, menstruation in female, it is not a disease, but it is also not a normal state. So these are the examples of physiological stress. Pathological stress is any disease. So whenever any cell is under stress, either physiolocal or pathological, so cell will do three things one by one. The first thing the cell will do in order to overcome the stress and survive in the stressful time, the cell will do adaptations. So the cell will do cellular adaptations. But the thing is that the cellular adaptations are reversible. Once you remove the stress, cell will come back to its homeostasis. For example, which I have quoted an example, once the exams are over, again back you will study for normal routine hours, that is 5, 6 or 7 hours. You cannot study daily for 16 or 18 hours like the day before exam. So once the stress is removed, again the cell will come in homeostasis, right? So all cellular adaptations are reversible. That is the first point. But what if the stress is continued? If the stress is continued, the second thing cell will do is cell injury. There are two types of cell injury, reversible and irreversible. So first, reversible cell injury takes place. But if the stress is still continued, the second thing which takes place is irreversible cell injury. The other name of irreversible cell injury is cell death. Cell death are of two types, apoptosis and necrosis. So the first thing takes place is cell adaptation. If the stress persists for a long time, then the second thing takes place is cell injury. Initially, reversible cell injury takes place, but after a point of no return, irreversible cell injury, also known as cell death, take place, which can be of one of the two types, either apoptosis or necrosis. So let me draw the diagram for the same thing. So you can see here I am drawing a cell. This is a cell. This is in homeostasis. But whenever stress is acting on the cell, stress, either physiological or pathological stress acting on the cell. So the first thing cell will do is cell adaptations. If the stress is continued, cell adaptations, if the stress is continued, the second thing cell will do is injury. That is reversible cell injury, and followed by, if the stress is still continued, it will result in irreversible cell injury. Irreversible cell injury, also known as cell death. That is apoptosis or necrosis. So we can say adaptations reversible cell injury and irreversible cell injury are the stages of progressive impairment of cell structure and function. So same thing. So how you will define cell adaptations? I have explained you adaptation. How you will define cell adaptations? So cell adaptations are reversible changes in the structure and function of the cell in order to overcome stress. So we can say cell adaptations, reversible cell injury, irreversible cell injury and cell death. These are the progressive stages of impairment of cell structure and function. In this flowchart also, you can see whenever stress is acting on a cell, the first thing cell is doing is adaptation. If the stress is continued, then cell injury takes place. There is a point of no return. You can see in this flowchart, before this point, there is reversible cell injury and after this point, there is irreversible cell injury. So here is the best diagram given in front of you. In this diagram, you can understand the cell here is the cardiac myocyte. Cardiac myocyte, if the stress is coming, if stress is only for short duration, the first thing is cell adaptation in the form of the hypertrophy, you can see. But if stress is continued for a long duration, the reversible injury taking place followed by irreversible cell injury or cell death. So you can understand this via this example also. I have already taught you the definition of cell adaptations. You can understand the points. What you have understood till now, the cell adaptations are reversible. Once you remove the stress, the cell will again come in homeostasis. These are the structural changes to physiological or pathological stress as a result of the stress in order to achieve new steady state, in order to continue to survive. So that is the definition of adaptations. Now coming on the type of adaptations. There are 5 types of adaptations: hyperplasia, hypertrophy, atrophy, metaplasia and dysplasia. So the 5 adaptations, the names are in front of you. You must understand the meaning of them. So you can see a very good, a beautiful diagram is depicted here. You can see here these are the normal cells. So as a response to stress, they are decreasing in size. You can notice the change in the size. Decrease in size is known as atrophy. You can, in the second diagram, you can see again these are the normal cells. Here, in response to stress, the cells are increasing in size. So increase in size is known as hypertrophy. The word trophy means size of the cell. So atrophy means decrease in size, hypertrophy means increase in size. Again, in the third diagram, you can see the normal cells, and in response to stress, they are not increasing or decreasing in size. The size is same, but they are increasing in number. So this is known as hyperplasia. The word plasia is number, right? In the fourth diagram, you can see these are the normal cells. In response to stress, they are changing from one mature type to another mature type. For example, initially if the cells are squamous, they are transforming into columnar type, or vice versa. If initially the cells are columnar, in response to stress, they are transforming into squamous type. So that is known as metaplasia, transformation of one mature type of epithelium, one mature type of cell into another type of cell, right? The last one is dysplasia, in which normal cells will do altered cellular development. Altered cellular development, that is known as dysplasia, and dysplasia is a pre-malignant condition. So these are the 5 types of cell adaptations, which the details of which we are going to study now. The same details are given here also in this diagram. So in this diagram also, you can see in the center, this is a normal bronchial epithelial cell. Now you see the 5 things around it, the 5 changes around it. Can you see this cell? I am marking here this cell. In this cell, you can notice the size is increased. Increase in size is known as hypertrophy. In this diagram, you can see there is decrease in size. It is known as atrophy. In the third diagram, you can see increase in number of the cell. It is known as hyperplasia. In the fourth diagram, you can see change in type of the cell. You can see the shape is changed. So one type of cell is transformed into another type of mature cell. It is known as metaplasia. And last one, there is disordered development, which is known as dysplasia. So the 5 types of adaptations, the diagrams are in front of you. Now I suggest you to remember the 5 types of adaptations in a easy manner. You should make this table. So make this table of the 5 types of adaptations. I will start with hypertrophy, then I will move to hyperplasia, then I will move to atrophy, then I will move to metaplasia, then I will move to dysplasia. In this manner, in this sequence, we are going to cover the 5 adaptations. You should know the definition of each of them. As I've already told you, you should know the diagram of each of them. You should know the mechanism of each of them, and you should know the types with examples of each of them. The most important are the types with example. Let me start with the first one, hyperplasia. I'm going to start the first type of adaptation, that is hyperplasia. As I've told you, the word plasia means number. The word plasia means number, and the word hyper means more. Hyper means increase. So it is increase in number. It is increase in number of the cell, not the size of the cell. So that is the definition. Increase in number of the cell, not the size of the cell. Because of increase in number of the cell, overall size of the organ will increase. It may occur with hypertrophy, or it can occur alone also without hypertrophy. That is the definition. I would like to draw a diagram for you. So for example, this is a cell. You can see this is a cell. It is a normal cell, right? Now in response to stress, if this cell is under stress, stress can be anything. It can be physiological, it can be pathological, as I have already taught you. So in response to stress, the cell is increasing in number. You can see. So instead of one cell, there are many cells. They are increasing in number. But if you notice, the size of all these cells is same as that of initial cell. The size has not changed. Only number is increased. This is known as hyperplasia. So that is the diagram. In this diagram, this one is hyperplasia, the third diagram. You can see the normal cells, and in response to stress, they are converting into multiple cells. The number is increased, right? So that is hyperplasia. What is the mechanism of hyperplasia? The mechanism of hyperplasia is increase in growth factor and growth factor receptors. Okay. So let me draw a diagram to explain you the mechanism of hyperplasia. So this is a cell. How does a cell divide? For the cell division, when any cell wants to do the cell division, there are growth receptors present on the surface of the cell. When growth factor comes and binds with this growth receptor, then cell is getting the stimulus and cell is dividing. So from one cell, 2 cells are formed. From 2 cells, 4 cells are formed likewise. So for the cell division, you require 2 things, growth factor and growth factor receptor, right? Now for doing hyperplasia, the number of growth factor and growth factor receptor both are increasing on the surface of the cell, so that more cell division takes place. And because of more cell division, the number of the cells is more. So that is hyperplasia. You got my point? Now there are 2 types of hyperplasia. Coming on the types with example. The 2 types of hyperplasia are physiological and pathological. The 2 types of hyperplasia, physiological hyperplasia and pathological hyperplasia. Let me give you a few examples of physiological and few examples of pathological hyperplasia. Start physiological hyperplasia. In physiological hyperplasia, I would like to give you 3 examples. The first example is female breast. I would like to draw a diagram here. Can you see? This is a female breast. This is a female breast. This is the nipple. This is the female breast. Now this is the size. These are the cells inside the female breast. At the time of three stressful times, that is pregnancy, puberty and lactation. Puberty, pregnancy and lactation. The size of the female breast increases. We all know the size of the female breast increases. Why? Why? The size of the female breast increases because the number of cells inside the female breast is increased. The size is not increased. The number is increased. This is an example of hyperplasia. Beautifully, I have drawn the diagram. You can understand it. So what is the stress here? Stress are 3 times: puberty, pregnancy and lactation. So during which hormonal changes are taking place. So hormones are the stress, estrogen and progesterone. These hormones are acting as a stress for the growth of the cell division in the breast. You got my point? So that is the first example. The first example is this. The second example is a pregnant uterus. You can see it is given in the diagram. You can see in the diagram, this is the uterus in a normal female, a non-pregnant female. You can see grossly how small uterus is it. But during pregnancy, you can see this is the size of the uterus during pregnancy. During pregnancy, we all know uterus increases enormously in size to accommodate the fetus inside it. So during pregnancy, the uterus is increasing in size. Now, if I take, this is the gross comparison, you can see. This is non-pregnant uterus and this one is pregnant uterus. If I make a slide of both of them, so this is the slide of non-pregnant uterus. If you can notice and zoom out and notice, these are the cells. These are the cells inside the uterus. These are the smooth muscle cells inside the uterus. And if you can notice the second diagram, which is a pregnant uterus, you can notice these are the cells. So the cells in the pregnant uterus, 2 things are there. They are increasing in size as well as number. So pregnant uterus is an example of hypertrophy as well as hyperplasia. The only example which is the example of both hypertrophy and as well as hyperplasia is the pregnant uterus. You can see it. So that is the second example. So these are the two examples of physiological hyperplasia. Breast during puberty, during pregnancy and during lactation, and uterus during pregnancy. So these are the two examples of physiological hyperplasia. Let me come on pathological hyperplasia. The second type of hyperplasia is pathological. Now here there are the diseases. There are few diseases which is causing hyperplasia in that particular organ or in that particular cell. The first example is endometrial hyperplasia in response to excessive estrogen. So in this diagram, you can see this is a normal endometrium. We know that uterus have three layers: endometrium, myometrium and perimetrium, outermost serosa. So endometrium, this is the thickness of the normal endometrium. But if this female is given excessive estrogen from outside due to any reason, due to hormonal therapy or any reason, due to treatment of some disease. So here the excessive estrogen will act as a stress, and that will cause thickening of the endometrium. Now the endometrium got thickened because of increase in number of cells in the endometrium. So it is an example. The disease is known as endometrial hyperplasia. It is not a physiology. It is a disease which occurs in excess of estrogen. So the name of the disease is endometrial hyperplasia. That is the first example of pathological hyperplasia. The second example of pathological hyperplasia is skin warts. You can see skin warts. What do you mean by skin warts? It occurs as a response of a virus on the skin. The name of the virus is HPV, human papilloma virus. So in this example, you can see this diagram. This is the diagram of a human skin having small nodular areas. These are the benign lesions. These are known as warts. Why these warts are formed? Because the skin cells here, they are doing multiple cell division. They are doing hyperplasia in response to a virus. The stress here is a virus. The name of the virus is human papilloma virus. So you should know what is the stress, and in response to stress, how that particular cell or organ is responding. So that is the example, the two examples of pathological hyperplasia. So we are done with the examples of physiological hyperplasia and pathological hyperplasia. Now let me start hypertrophy. The second type of adaptation is hypertrophy. We are done with hyperplasia. Let me start with hypertrophy. The second type of example is hypertrophy. So what is hypertrophy? Trophy means size. Hyper means more. So it is increase in size, not the number of the cell. So let me draw a diagram here. Can you see? This is a cell. This is a normal cell in homeostasis. But whenever stress is acting on this cell, whether the stress is physiological or pathological, at that time, this cell will respond to stress by increasing its size. So this is the adopted cell, the adaptation, the cell showing adaptation, and this adaptation is known as hypertrophy. The cell is increasing in size, not the number. So that is the definition of hypertrophy. Because of increase in size of the cell, the overall size of the organ will also increase. What is the mechanism here? The mechanism is not the cell swelling. It is not the thing that this cell is swelling. No, swelling is not the reason of increasing in size of the cell. No, swelling is not the reason. The reason of increase in size of the cell in hypertrophy is due to more structural components and cellular proteins inside the cell. Just for example, each cell has structural components inside it. Each cell have mitochondria, endoplasmic reticulum, lysosomes, various structural components. During hypertrophy, all of them increase in number. So more mitochondria, more endoplasmic reticulum, more ribosomes. So because of increase in proteins and structural components of the cell is increasing in size. It is not due to swelling. You have to learn this negative finding also, right? So that is the definition. In this diagram, where is hypertrophy? This is the diagram of hypertrophy. You can see these are the normal cells. In response to stress, they are increasing in size. Appreciate increase in size in this diagram. That is hypertrophy. Now coming on the examples of hypertrophy. There are two examples of hypertrophy, physiological and pathological, just like hyperplasia. Let me give you a few examples of physiological hypertrophy. I have already given in the last adaptation only. Can you remember what is the example of physiological hypertrophy? Pregnant uterus. As I have told you, pregnant uterus is an example of physiological hyperplasia as well as physiological hypertrophy. So in this diagram, you can see this is a non-pregnant uterus. This is a pregnant uterus. You can appreciate the increase in size grossly, as well as this is the diagram of non-pregnant uterus, and this is the diagram of pregnant uterus microscopically. And you can appreciate the change in the cells the size of the cell as well as the number of the cells. So size and number both is increasing. So pregnant uterus is an example of hypertrophy as well as hyperplasia physiological. Let me come on few examples of pathological hypertrophy. Here I would like to give you 3 examples of the 3 muscles. Human body have 3 type of muscles. What are the 3 type of muscles? We have skeletal muscle, we have cardiac muscle, and we have smooth muscle. So all these 3 muscles show pathological hypertrophy in case of some stress. So let me take the example of cardiac muscles first. See this diagram. See a beautiful diagram of the heart. Can you see the 4 chambers of the heart? Can you see a beautiful diagram of the heart? Can you see the complete vessels, arteries and veins arising from each of the chamber? You already know it is normal. So all of them are normally drawn here. Now imagine if aortic stenosis is taking place. This is the aorta and this is aortic stenosis. This is the aortic wall. If aortic wall is showing aortic stenosis, or there is bicuspid aortic wall. If bicuspid aortic wall is there, what will happen? So when this left ventricle try to do the systole, left ventricle try to contract, because the lumen of the aorta is narrow because of aortic stenosis, the blood cannot move into the aorta. Blood is unable. So more and more blood is remaining in the left ventricle only. So it is acting as a stress for the left ventricle. The more blood which is remaining in the left ventricle, because it is unable to move into the aorta, because of aortic stenosis or bicuspid aortic wall, it is acting as a stress. It is acting as a stress for the left ventricle. So the wall of the left ventricle, the cardiac myocytes, the cardiac cell will respond to this stress by increasing in size. So that's why we say it is left ventricular hypertrophy. Left ventricular hypertrophy, it is an example of pathological hypertrophy. You know what is the stress here? The stress is obstruction in the wall. Aortic stenosis, bicuspid aortic wall, or systemic hypertension. These are the stress, right? Coming on smooth muscle. I will give you an example of smooth muscle. See this diagram. Can you see this diagram? Here, this is esophagus. In the normal, you can see this is esophagus and this is stomach. At the junction of esophagus and stomach, there is a sphincter. It is known as lower esophagus sphincter. It is known as lower esophagus sphincter. Normally, this sphincter is always closed. But whenever we eat anything, at that time when the food bolus is going in the esophagus, at that time the sphincter opens and food passes from the esophagus into the stomach. This is a normal physiological phenomenon. We all know that. But there is a disease which is known as achalasia. What happens in this disease? In this disease, the lower esophageal sphincter undergo hypertrophy. It is undergoing hypertrophy and it is closing. At the time of the swelling, it is not opening. So this is an example of pathological hyperplasia in the smooth muscle. In the smooth muscle of the esophagus in the lower esophagus sphincter. So the disease is known as achalasia. That is an example of smooth muscle hypertrophy. Coming on the third, skeletal muscle hypertrophy. Whenever we do gymming, a laborious work, some exercise, so the biceps, triceps, they are increasing in size, right? Why they are increasing in size? Because the exercise is acting as a stress here. The gymming, the exercising, the physiotherapy, it is acting as a stress here. And it is increasing the size of the cells inside the bicep and tricep skeletal muscle. That's why overall the muscle increases in size. So that is an example of skeletal muscle hypertrophy. This is an example of smooth muscle hypertrophy. And this one is an example of cardiac muscle hypertrophy. So the 3 type of muscle hypertrophy is in front of you. We are done with hypertrophy. Let me start the third type of adaptation, atrophy. We have completed hyperplasia. We have completed hypertrophy. Now I'm starting with atrophy. What is atrophy? As I've already told you, atrophy is decrease in size. It is decrease in size and number of the cell. So I will draw a diagram to explain you more beautifully. See, this is a cell. See, this is a cell. The cell is under homeostasis. But whenever the stress is acting on the cell is responding to the stress by decreasing in size, not by increasing in size, not by increasing in number, but it is responding to the stress by decreasing in size. And this is known as atrophy. The decrease in size is known as atrophy. So that is the definition of atrophy. Atrophy is decrease in size and number of the cell, right? So the cell become atrophied. It is smaller as compared to normal size. What is the mechanism here? Mechanism here is, it is not the shrinkage. It is a shrinkage of the cell, but it is not simple shrinkage of the cell. The cell becomes smaller in size because the structural components inside the cell are reduced. It is reduced to such a level that this cell is still viable. This cell is still viable. So in this diagram, you can see this is the diagram of atrophy. The first one is the diagram. Here, these are the normal cells. In response to stress, they are decreasing in size and number. So this is an example of atrophy. Let me come on the examples of atrophy, the types of atrophy. So again, atrophy are also of two types, physiological and pathological, like hypertrophy and hyperplasia only. These are of two types. So tell me 5 examples of physiological hypertrophy and 5 examples of pathological hypertrophy that you have to learn. It is a very important topic from exam point of view, and this question, individual adaptation, comes in exam, in university exams for 2 marks or 3 marks, or a long question containing all 5 adaptation can come for the long answer, long question for 5 marks. So it is a very, very important topic, ultra important topic for the exams of MBBS. Let me come on the examples of the atrophy. In the examples of the atrophy, let me start with physiological atrophy. In physiological atrophy in human body, there are few examples in which physiologically the size of the organ reduced. It is physiological, not a disease. For example, atrophy of the lymphoid tissue with age. We know that with age, the lymphoid tissue reduced in size as compared to children. Atrophy of the thymus in adult life. In adult life, the thymus is disappeared, it is atrophied. Atrophy of the ovaries after menopause in female. We know in females, after menopause, the ovary reduced in size. So the reduction is due to atrophy. That you have to learn. Decrease in size of uterus after parturition. What I have told you? Okay, let me draw a diagram. Can you see? This is a normal uterus, non-pregnant uterus. During pregnancy, the uterus increases in size because of hypertrophy as well as hyperplasia. I have told you pregnant uterus is an example of both. After delivery, the uterus again reduced in size. What is the reason behind it? That is known as parturition. So after parturition, the reduction in size of the uterus is due to atrophy. So that is the example of atrophy. Atrophy of the brain with age. Can you see the two brain diagrams? Can you compare the gyri and sulci in them? See the first diagram, it is the brain of a young person. See the second diagram, it is the brain of an old person. Now, can you compare? In the old person, the tissue inside the brain, the parenchyma in the brain is atrophied. So you can see a deeper sulci, a narrow gyri and a deeper sulci. So you can see the brain is atrophied in old age. So it is a physiological phenomenon. It is not a disease. So with aging, the atrophy of the brain. And the last thing, with aging, osteoporosis of the bone becomes thinner with age. So that is osteoporosis of the bone. So these are the examples of physiological atrophy. Let me teach you examples of pathological atrophy. There are many examples. I will show you the diagram. Can you see? Here the child, it is a diagram of a child. All the organs inside the child, they are atrophied. All the organs, the complete body is atrophied. This is known as cachexia. This is known as cachexia. It is seen in severe malnutrition. It can be seen in severe illness. It can be seen in cancer. So complete body atrophy is there. It is known as starvation atrophy. So the child is not eating anything. That's why all the organs in human body, all the organs inside the child, they are atrophied. This is known as starvation atrophy, the first type of pathological atrophy. The second is ischemic atrophy. In ischemic atrophy, can you see the two kidneys? This kidney is larger, this kidney is smaller. Why? See, this is aorta. From the aorta, the two renal arteries are arising. See, this artery is normal, but this renal artery, it is stenosed. It is obstructed. So this kidney is not getting blood. Since this kidney is not getting blood, it is reduced in size and showing the atrophy. So such atrophy is known as ischemic atrophy, which is occurring in reduction of blood, in absence of blood. Due to less blood, this atrophy takes place. So the first atrophy was starvation atrophy. It was occurring in absence of food. The second atrophy is ischemic atrophy. It occurs in absence of blood. The third atrophy is neuropathic atrophy. It occurs due to defective nerves. The best example is polio. Can you see polio? In the polio, can you see the limbs, the lower limbs or the upper limbs of the patient are thinner as compared to the peer group? Why they are thinner? Because the muscles here are atrophied. Why the muscles are atrophied? There is no problem in the muscle. The problem is in the nerve supplying the muscle. The polio virus, the picorna virus, the polio virus destroy the nerves supplying the skeletal muscles, especially legs, right? So the legs are atrophied. So that is an example of neuropathic atrophy. The fourth atrophy is endocrine atrophy. Have you heard about hypothalamus, pituitary and peripheral organ axis? You may be heard about it. So hypothalamus secretes some hormones which go to the pituitary. From the pituitary, other hormones released and they go to the peripheral organs. So from pituitary, ACTH come and ACTH go to adrenal cortex, adrenal gland. TSH come and TSH go to the thyroid gland, and LH and FSH come and they go to ovaries and testes of male and female, respectively. So imagine a person in which pituitary is damaged. There is hypopituitarism, or there is trauma to the pituitary, there is tumor to the pituitary, pituitary is damaged due to any reason. So ACTH, TSH, FSH and LH will not be secreted from the pituitary. So all the organs, that is adrenal gonad, adrenal cortex, thyroid, ovaries and testes in males and females, they are atrophied. So here the atrophy is due to hormone, due to the hormone secreted by the pituitary. Such atrophy is known as endocrine atrophy. In absence of hormone, it is taking place. The last one is the pressure atrophy. So here you can see there is a tumor in the meninges. Meningioma is there. So that meningioma is causing atrophy of the skull bone. Atrophy of the skull bone. Can you see the skull bone is atrophied because of the pressure which is caused by the meningioma on the skull bone. So that is pressure atrophy. Let me summarize what we have learned today. Let me tell you the summary, what we have learned today. We have started studying the various types of adaptations. We have studied what is adaptation. We have learned what are adaptations. The various types of adaptations. We have started with hyperplasia. In hyperplasia, there is increase in number, not the size of the cell. Then we moved on hypertrophy. In hypertrophy, there is increase in size of the cell, not the number of the cell. And then we moved on atrophy. Atrophy is decrease in size and number of the cell. For each of them, we have learned their types and example. Each of them are two types, physiological and pathological. Physiological and pathological are the two types in each of them. But you have to learn the examples inside each of them. In each category, I have taught you the important examples that you have to learn from exam point of view. So that's all for this session.